To that, you really don't have to be a philosopher to see that the ideas being presented are dubious. For instance, one idea suggests if your therapist recommends a gratitude journal, you need to drop them. Blanket dismissals like this are reckless. Gratitude interventions can be ineffective or harmful when poorly matched, but not for the reasons that you think. This could also be because of cultural differences, clinical impressions, developmental considerations. However, whether an individual likes it or not, gratitude interventions are also evidence-based tools that have shown benefit in some cases of depression, including existential distress. The real issue, I think, is fit and formulation, not the tool itself. If a client rejects the practice or if the activity isn't prefaced appropriately, a competent therapist must adjust. And then there's this idea that says this is a philosophical issue, not depression. This idea erases the reality that many people experiencing void states also meet full diagnostic criteria for depression. The two are not mutually exclusive. Existential despair and clinical depression can coexist. A skilled therapist holds both with nuance and not reductionism. And then another idea says therapists haven't been to the void, so they can't help. Now picture this. You go to grad school, internship, take on loan debt, and then do full-time, high-impact, pre-licensed work for $40,000 a year for at least 2 years while paying for your own supervision. What does that sound like to you? What this idea is doing instead is romanticizing suffering and dismissing clinical training, supervision, and decades of research on suicidality, trauma, and existential crises. And effective therapy doesn't require the therapist to have experienced everything the client has. Instead, therapy requires attunement, humility, and evidence-informed care. And if at this point one finds that their current or previous counselor did not provide that to you, I'm deeply sorry for what you missed out on, and I encourage you to find another and try again. And then there's this bold claim that CBT is ineffective. But then in her previous videos, she cites behavioral activation as a viable existential approach. I mean, come on. Where do you think behavioral activation comes from? One would think to look at the title of the book from which they learned about BA. I mean, look, we do have a CBT problem. When novice clinicians enter the field, CBT is usually their first framework they work with. And there is a reality where many of these individuals either did not fully understand CBT or misused basic CBT principles as a safety blanket, misappropriating CBT interventions into a surface-level band-aid while inadvertently compromising their therapeutic alliance in the process. And here we are. When in reality, CBT fits as an existential intervention and more. You just need to link up with someone who's trained on this for years. More on this in a future video, I guess. But then this video suggests to me to use ChatGPT as an existential guide instead, albeit with some reservation. But using commercially available AI in place of a qualified human connection during an existential crisis can be critically dangerous, especially when vulnerable viewers might already feel isolated. Yeah, ChatGPT can find insightful informational resources for you, and it will predict language enough to make it sound like you're seen. But again, commercial AI for therapy is simply not safe at this time. Now, here's where the gloves come off.